Health Minister Joe Phaahla is concerned about the dwindling number of people who are taking HIV treatment. It's in fact been more of a decline, shall we say, in the number of people receiving treatment. Phaahla says most of the people eligible for treatment were not collecting medication during the peak of the COVID-19 lockdowns. Let's take this up with Letta Seshoka, Program Manager for HIV Treatment and Care in the Department of Health. A very good afternoon to you, ma'am. Thank you for your time. So, the levels of people coming forward for treatment are now back above 80%, but how concerning a decline is this?
Okay, thank you, Tembegile. Good afternoon, viewers. The challenges that we are facing, I think it's more of making sure that patients that are back in care are being recorded and are being reported to the higher level so that the number of that 80% and more improve. And I think the challenges behind that is that you are using a system, the tier.net, which is a standalone system that needs one to capture the information which comes from the clinical file of a patient. And the notes are written by our clinicians, and capturing is done by our data capturers. So a lot has to be done to ensure that that is being captured. As the data move to higher level, it represents the number of patients that are on treatment.
So say someone had already been taking treatment at the beginning of 2020 and they stopped taking treatment when we went into that level 5 lockdown and stayed off treatment, let's say for a few months, a year, perhaps 2, because that's where we are now. What would be the health danger, or how problematic would that be for them?
I think the main problem is the infection now is increasing. Remember that currently we don't have a cure for HIV, but it's treatable. Making use of the ARVs, you can treat to ensure that the viral load becomes suppressed, and that will also help not to transmit it to your partner. Or even in pregnant women, if they are on ARV and virally suppressed, it doesn't been transmitted to the unborn child. By the child is born, it's negative. So we're still making campaigns to say those who miss to come or are lost to follow up, they should come back in care so that we start again according to our guideline, that we start to initiate them or to start them on treatment after taking the whole history. What is the reason behind, besides the pandemic that we were in? And together with the client, we plan accordingly. How can the patient in future not miss the treatment, and make sure that treatment is taken daily? That will make the viral load to be suppressed, or the HIV to be suppressed.
And you said that infection at the moment is increasing in South Africa. Put that in context for us and what it looks like at the moment.
It's mostly the increasing, it comes from the new infection, really. I think if infection, in a sense that 15 to 24, as we know that we do have also a strategy of prevention. If they are not preventing, using of a condom, for example, at the same time not taking treatment, that will always increase the infection when you have a sexual intercourse with your partner and not even knowing your viral status. How high is it? Because it has to be virally suppressed or undetectable viral load.
And why are we seeing that problem, ma'am? Pardon me. Why are we seeing that issue with the increase, especially among younger South Africans, at a time when you could argue that HIV/AIDS information is more easily accessible than it was in the 90s, for instance?
The main issue around is about the condom use as a start. Remember the condom use, we educate on how to make use of it, the benefits of it. But when you are in the bedroom, that's where the challenge is, that either it's being used or not used. Secondly, I think the high level of our youth are always making use of alcohol, and by the time that you have had enough alcohol, there's no time to make use of a condom. And maybe the multiple partners that really make this not to be under control.
What then is the strategy to tackle that aspect?
The strategy, again, it goes also to the youth and adolescents, where we are having those campaigns in the youth zone, the friendly youth services in facilities, in terms of continue to educate the youth about the benefit of prevention, and either prevention as treatment, which I didn't mention, that whilst being negative, prevention and treatment, you can make use of the PrEP. But if already you are HIV positive, you are on ARVs, continue to be on ARVs, continue to make use of the condom, and continue also to educate others. Mm-hmm. As long as you've got a partner or multiple partners, if you protect yourself, you'll be protecting many.